Assalamu alaikum. This is Sania Ali, and in this presentation, me and my other two groupmates, Fouzia and Rahayma, are gonna present the link between health and economic growth. So, without wasting any minute, let's start to understand how can health and economics work together for a better future. You all might have heard the famous saying that health is wealth, and in Urdu, we say "Jaan hai to jahan hai." So, these two famous sayings can clearly tell us about how much health is important for us. So, by the end of the presentation, inshallah, you will be very clear towards the link of health with economics. In this slide, you can see how health can impact on economy. If the population is healthy, then the economy will be prosperous, started developing, and if the population having bad and poor health issues, then there will be the consequences in the growth of economy. So moving to the next slide, first thing we need to know is what is health. So the health is a state of complete physical, mental and social well-being. It's not only the absence of diseases, but a person said to be healthy when he or she is mentally happy and his or her social relationships are healthy in the society and they are stress free. So, in the next slide, we will see some famous sayings about the health and economics. The first saying is a healthy nation is a wealthy nation. So, for better understanding, I have some examples about the countries facing health issues. So, I took example of our neighboring country, that is Bangladesh. So, Bangladesh is facing diabetes issue from a very long time. But now the government of Bangladesh has taken steps to reduce diabetes and they educate their people about how to prevent from diabetes because prevention is better than cure, so that no more people could affected by this disease. And the government of Bangladesh has also developed and established healthcare programs to reduce diabetes. Now I have an example of a very developed country, that is US. Yes, United States also has major health issues like heart attacks, cancer, chronic lung diseases, diabetes, and of course obesity that is increased 15% between 2011 and 2019 and now affect more than 70.4 million adults. But they have taken sensible and wise decisions for the country's healthcare and provided the best health facilities to the people so that their country could grow more better and better. But we don't need to go so far. We all have seen the world facing COVID-19 pandemic, which has stopped every economic activity. Every work had stopped at that time. Everything was affected, and every country's economy has disturbed because of the bad health. And then every country started to cure their people so that the country could started working normally as a healthy nation. And the second saying is a saying that we have been listening since our childhood till now, that an apple a day keeps the doctor away. So if we take healthy diet, do exercises and adopt healthy positive habits, then it will definitely reduce our medical cost. And the third saying is the best thing, that wealth is nothing without health. This is what I said earlier, that jaan hai to jahan hai. So if we have a good health, so we can enjoy every achievement and every success in our lives, and we can also see the development of our beloved country.
After that, we are discussing about the relationship between health and economic growth. The link between health and economic growth is like a two-way street. When people are healthier, they can work better, which boosts productivity and makes the economy stronger. It also means less money spent on healthcare, leaving more for other things. On the flip side, when the economy grows, there is more cash to invest in things like hospitals and making sure everyone can get good healthcare. So basically, good health helps the economy, and a strong economy helps keep people healthy. Now we discuss about impact of health on productivity. Health plays a big role in how much work gets done and how well it is done in growth of economy. Number 1, healthier workforce. When workers are healthy in body and mind, they can work better and for longer periods without being held back by sickness. Number 2, less absenteeism. Healthy workers are less likely to miss work due to being sick, which means they can be at work more often, getting more done. Number third, enhance cognitive function. It's mean good health helps people think better, focus more, remember things and make smart choices, which make them more valuable contributor at work. The next is investment in healthcare and economic development. Investing in healthcare helps in many ways, like number 1, improve health outcome, number 2, innovation and research, number 3, cost saving, and number 4, talent attraction. Improve health outcome. When we spend on healthcare, people get healthier, which means they live longer and work better, boosting the economy. Number 2, innovation and research. Putting money into healthcare leads to new medical stuff like better treatment and gadgets. This creates job and make the country better. Number 3, cost saving. Taking care of health problem early saves money in the long run, leaving more for other important things. Number 4, talent attraction. Having good healthcare attracts smart doctors and researchers, making the country better and the economy stronger. Now we discuss how we reduce the burden of disease for economic prosperity and development. To boost the economy and grow, we follow three steps. Number 1, disease prevention. Number 2, healthcare access. And number 3, workforce health. Disease prevention means taking steps to stop illness from happening in the first place. By investing in programs and initiatives that promote good health and prevent disease, we can keep people healthier and more productive. Number 2, we discuss healthcare access. Make sure everyone can get good healthcare without it costing too much. Number 3, workforce health. Encourage people to live healthy lives and have programs that work to keep them well and working hard.
Assalamu alaikum. This is Rahayma Batool. So after that, here I am discussing about the factor of health and economic growth. So basically, there is a close relationship between economic prosperity and health, frequently functioning in a manner where advancement in one can an improvement in the other. The following are some crucial elements that highlight their interdependence. Basically, there are lots of factors, but here I am discussing only three. The first is healthy population. A healthy population that is in good physical and mental health is more creative, industrious, and capable of boosting the economy. The second one is the allocation of funds on education. Basically, spending money on education increases human capital for economic growth and enhance health outcomes by teaching workers about cleanliness and health issues. The third one is a strong health system. So the next one is robust healthcare system. It means the strong health system. Economic prosperity is enabled by an accessible and high quality healthcare infrastructure that promote diseases prevention, treatment and general population well-being. Now, we are moving to our next slide, that is the consequences of poor health on the economy, which means the effect of unhealthy people on the economy. So, the first one is reduced productivity, which means decline in productivity. People's capacity to work efficiently is compromised when they are ill, whether it is from infectious disease or mental health disorder. This results in reduced workforce productivity. The second one is a higher healthcare cost. We also say that the increased in medical expenses. It means
individuals, company, and the healthcare system bear a significant financial burden while treating illness and preventive diseases. The third one is slower economic growth. It means the reduced rate of economic expansion. Now, the fourth one is widening inequality, which means growing disparities. Basically, poor communities are disproportionately affected by unequal access to high quality healthcare, which causes socio-economic inequalities. So, basically, after that, the next slide is the role of education in promoting health and economic growth. The role of education in promoting health and economic growth refers to the significant impact that education has on both individual and society well-being and prosperity. Basically, this concept encompasses several key aspects. The first is educating for better health, which means teaching for improved health. Having a thorough understanding of nutrition, cleanliness, and disease prevention enables people to make decisions that promote both individual and community health. So, basically, the skilled workforce for productivity, training, healthcare professionals, and cultivating health. Conscious citizen, these all are the role of education in promoting health and economic growth. So, in the last, economic and health initiatives must be integrated for sustainable development. Country may increase workforce productivity and accelerate economic growth by investing in healthcare and encouraging healthy lives. Hence, it is completely proven that health is wealth and wealth is nothing without health. So, as we discussed earlier that jaan hai to jahan hai. So, keep healthy by all means so you can serve your country and make it develop. Hope you are liking our presentation. So, thank you. Allah Hafiz.